Now we're going to see the diseases caused by the fungus Aspergillus. We have Aspergilloma, chronic necrotizing pulmonary aspergillosis, invasive pulmonary aspergillosis, and allergic bronchopulmonary aspergillosis. The allergic bronchopulmonary aspergillosis is a hypersensitivity reaction to the Aspergillus, to the fungus, that is seen in patients with asthma or cystic fibrosis. The clinical presentation would be pretty much that of restrictive pattern on the pulmonary function test and the clinic of that. So, restrictive pulmonary pattern. And for the diagnosis, besides the clinical suspicion, we need to have eosinophilia in the labs, because this is a fungus. We have increasing IgE switching that activates the eosinophils. So this is needed for the diagnosis. And treatment is just some itraconazole for long term and corticosteroids to decrease the inflammation. For Aspergilloma, this is a incidental finding most of the time that is seen on a CT scan of the chest, showing a solid mass in a cavitary lesion. This is seen in patients with pre-existent lung disease like TB or COPD. So the TB causes the cavitary lesions, and then the Aspergillus produces solid mass. The clinical presentation is hemoptysis most of the times, but also cough, fever. And for symptomatic patients, the treatment is surgical removal or embolization. The chronic necrotizing pulmonary aspergillosis, this is a rare antibiotic resistant pneumonia. So the clinical presentation is like pneumonia, but it is not resolving with antibiotics because of the fungus. Also, the patient can have night sweats, fever, fatigue, etc. This is the clinical presentation. This affects patients that are immunocompromised, like alcohol disorder or COPD patients. The diagnosis is like finding a pneumonia that is not resolving with antibiotics, and the treatment is voriconazole or another itraconazole, but most of the times voriconazole. And invasive pulmonary aspergillosis, this is a rapidly progressive infection that starts in the lungs and myotinously disseminates, so to the blood and all the body. It can lead to septic emboli. The diagnosis is finding galactomannan antigen. If this is negative but the clinical suspicion is high, we can do a bronchoscopy with bronchoalveolar lavage to test for the galactomannan assay, or PCR for the Aspergillus, or we can do a lung biopsy. The clinical presentation of this would be fever, pleuritic chest pain, cough, tachycardia, tachypnea, hypoxemia, and this is seen in patients profoundly immunocompromised, like transplant patients or chemotherapy patients. The treatment again would be voriconazole. So the disease produced by Aspergillus include allergic bronchopulmonary aspergillosis, that is just a hypersensitivity reaction in patients with asthma and cystic fibrosis. The next, less severe, is Aspergilloma, a incidental finding in patients with pre-existent lung disease. The chronic necrotizing pulmonary aspergillosis is a antibiotic-resistant pneumonia that presents with the, let's say, clinical triad of fever, pleuritic chest pain, and hemoptysis. This is seen in patients, in immunocompromised patients like COPD patients, and the treatment is voriconazole. And invasive pulmonary aspergillosis is a rapidly progressive disease starting in the lungs and is seen in severely immunocompromised patients like transplant patients or chemotherapy patients. And the diagnosis is with galactomannan assay or PCR for Aspergillus. Usually it would be blood testing only, but if the galactomannan assay is negative, we will do bronchoscopy with either lung biopsy or bronchoalveolar lavage to see the PCR or galactomannan antigen, and the treatment is again voriconazole.